Welcome back. There is a live look outside from the Oregon coast. That's our Init Spanish Head Resort Hotel camera capturing the surf there in Lincoln City. Thanks for watching Afternoon Live. Have you ever been told that you have irritable bowel syndrome and that you just have to live with it? It could be IBS or it could be something else altogether. Here to explain more about the intestinal issue known as SIBO, we welcome Naturopath Dr. Holmes. Thank you for joining us today.
Of course, thank you.
This is a new term I think a lot of people are just learning about for the first time. So we've got the acronym here. Can you break down SIBO and some of the things that people are experiencing?
Yeah, sure. So SIBO is Small Intestine Bacterial Overgrowth, and really what we're talking about here is dysbiosis. So basically people's ratios of good guys to bad guys in their small intestine is leaning more towards bad guys than good guys. Because
there should be a certain number of bacteria and all different things in our gut, but yeah, the ratio is off.
Exactly. Yeah, when we consume fiber and take probiotics and do that kind of stuff, we're really supporting large intestine health. So here we're talking about small intestine health. So for various different reasons, critters from the large intestine oftentimes will migrate into the small intestine.
Oh, okay.
And then here we get the bloating and the gas and the discomfort and all the things that can come along with that may look like IBS.
It makes sense too that people who are taking a probiotic and think they're doing all these things to help their gut health, it's a small intestine issue at the end of the day. So that could be really confusing.
Exactly.
So how does it develop? Why does this happen?
Good question. So when I see people, what I do is I run through a lot of underlying risk factors. One of the things I see most commonly is after food poisoning.
Oh, okay.
So someone might get some sort of traveler's illness or get upset, and they, it really throws their gut off, and it's just never quite right sense. But then I see people that maybe have hypermobility issues or other things that can throw off the ratio of good guys or bad guys.
Is there something connected to a previous surgery as well that could lead to issues down the road?
Yeah, of course. So with SIBO, we're really looking at two things. One, again, the ratio of good guys to bad guys, but also the motility of the gut.
Okay.
So how well things are moved through, specifically the small intestine. So when you bring us something like surgery, we can develop what we call adhesions or scars inside the small intestine that can literally lock things up and gum things up so that things don't move through very well.
So can you walk us through some of the symptoms again, because they can kind of mirror or look a lot like IBS or other related things?
Yep. So oftentimes I see people, they tell me, I wake up in the morning and I feel really flat, right? And then as the day goes on, I just feel more and more bloated or more and more distended. Or I feel like, I used to be able to eat whatever I want and now I don't know what to eat. I feel like I get a lot of bloating, a lot of gas. Acid reflux, or the other thing I can see really commonly is stool changes, either loose stool, more constipated stool, or both.
Okay, and then are there skin issues that can come up as well?
Yeah.
That's super confusing.
Right. It could look like anything. There's kind of, I see brain fog, lethargy, fatigue, but even with the skin stuff like you mentioned, I say often that the gut is like the canary in the coal, or the skin's the canary in the coal mine for the gut. So oftentimes when people have like eczema or acne or other sort of chronic skin issues, if we treat the gut, oftentimes their skin stuff will get better as well. So
you feel like you have some of these issues, you haven't gotten definitive answers. Is there a specific test where you can really diagnose this? Yeah,
I mean, what I say is it's kind of like a three-legged stool, right? Do you have the symptoms associated with SIBO, like we just ran through? Do you have risk factors, like we talked about? And then, there's something called a lactulose breath test, or different types of breath tests. So this is these tubes that you blow into, so it's actually collecting your air. Because again, we're talking about trapped gas in the abdomen, so you're blowing this out. And then we're seeing that is what helps us diagnose it.
That's pretty fascinating. You can actually blow air into a tube and then you can analyze that and break down what's going on deep underground, really.
Yep.
So what happens after you get a diagnosis? Are there certain treatment options to move forward with?
Yeah, and I think that's the important thing is the treatment options usually make people feel a lot better, right?
Great.
So as naturopaths, the amazing thing about my education is we have a lot of different herbal therapies or plant-based therapies, but we also use pharmaceuticals and medications to treat it. But commonly people try to change their diets to address this. I find that it's really not a food issue. I find that once we're actually treating the SIBO, that people are able to expand their diet, eat more foods, and really kind of get some of their normalcy back.
Is that such a relief? I'm sure people have come to you and they've spent maybe months or years adjusting their diets, cutting things out, and it's kind of sad when you have to cut out your favorite food groups and then you get to go a different direction and realize it wasn't the food after all.
Right, go out to eat with friends, all those different things that I see people are impacted because of this.
Are there certain things that make this tough to uncover or diagnose for people who are seeking treatment from just their primary care doctor, maybe?
Yeah, I mean, like you mentioned, for a lot of people, this is the first time they're hearing about it, right? So I think that it's garnering a lot of traction and getting more well known. But I think a lot of it is just education.
So what about, are there any steps to prevention? I would imagine for some people that's not maybe possible, but steps we can take in our everyday lives to make it less likely.
Yeah, well, the things that we could do just to support our gut health in general is things like chewing our food really slowly, right? Not shoveling things down, working on deep breathing, like all these things that are good for our motility, right? Like supporting the motility. But like you brought up with the surgery piece, sometimes it's just the thing that tips the person's bucket over.
Right.
You know, it's things that are out of their control. They get food poisoning, just tips their bucket over, and now, you know, their gut's just not quite right sense.
Do you find with folks, you mentioned something earlier like having a food illness or something you picked up while traveling, once you have kind of flushed that out, can you get back to kind of some normalcy in your life?
Yeah, oftentimes a lot of people can. I think it's more like the small, you know, you say small, but it's probably 20% of the population that after they get that, maybe they aren't quite right, you know? 80% of people, they get food poisoning, sure, they just bounce right back, but certain people, it's just, you know, yeah, their bucket tips over and here they are.
Are there certain telling signs for you where you can differentiate maybe a SIBO patient from an IBS patient?
Good question. The overlap is pretty huge, honestly. And you know, there's actually some reason to believe that the amount of people that have been diagnosed with IBS, it's actually SIBO for a lot of those people. So I think that doing the breath test, like we talked about, looking at the underlying risk factors. So again, I think about that three-legged stool, like I said. So if it looks like that, then I'm thinking more SIBO than just your traditional IBS.
And then in terms of reoccurrence for somebody who's gotten some treatment, they're feeling better, what are the chances they might experience something like this again?
Yeah, it's a good question. You know, for some people, what I tell people is like we kind of have to keep our foot on it maybe forever. You know, sometimes people are able to do a round treatment, they're good to go. You know, never see them again. Certain people, you know, it's like I say, some people get migraine headaches, some people get back pain, right? Like other people, their gut is like their sensitive spot. So, you know, we kind of have to figure out what we need to do on a minimum daily basis just to kind of keep everything happy right there. Well,
it's so encouraging. I mean, knowledge is power, so I feel better knowing all of these steps that we can take moving forward if we do end up in this situation. Thank you so much for spending some time with us today.
Of course, thank you.
We'll have more information on our website at katu.com. We'll be right back with more Afternoon Live right after this.